My name is Dr. Sundar. I'm a cardiothoracic surgeon, and my colleague here is Dr. Madan Kumar, who is also a cardiothoracic surgeon. And we have yet another colleague, Dr. Paul Ramesh, who is not present here because he's currently operating. Our guest here is a patient who's flown many miles away from Africa, basically with an infection in his liver, which has affected the functioning and the conditioning of his liver. Now, among the various treatment options offered to him, he was also being assessed for suitability to have a liver transplant, meaning removing a part of his diseased liver or removing his diseased liver and transplanting it with a healthy liver from a suitable donor. While he was being assessed by the liver team, he had a whole body checkup when it came to light that he had a shadow in his lung. Now that had to be evaluated further, because if one were to have a liver transplant, he would be on strong medicines to prevent rejection of the liver, what we call immunosuppression, which reduces the body's immunity. Now, before we carry out such an operation, we've got to make sure there is no infection anywhere in the body, there is no tumor, there is no cancer. So he was subjected to a biopsy, a needle biopsy with the use of a CT scan, and that did show the presence of cancer in the lower lobe, the lower half of his left lung. He was then worked up to make sure that the cancer was confined only to the lung and that it was not spreading anywhere else, which proved to be the case. And then we scheduled him for lobectomy, which is removal of that part of the lung which had the tumor. My colleague Dr. Madan Kumar would elaborate on the operation and the course after.
Yeah, we made an incision on the left lateral aspect and removed the whole of the left lower lobe, and the procedure went on very well. He was transferred to the intensive care with ventilation, and then he was extubated soon after. And he also cooperated well with our chest physiotherapy, which is a very major part in this management. And he had a very remarkable recovery, and he was discharged on day 6 post-op, and he was doing fine.
I'm very grateful to the Apollo team of surgeons who worked on my lungs, the surgery on my lungs. I was surprised when I woke up and was told that it was several hours, as much as 18 or so hours after I was wheeled into the theater. And I said, wow, I didn't know it's so smooth. And it gave me an impression. The impression I had was that these people must be very skilled, the anesthesia very smooth, and I thank God that it was successful. And I think few places will you have such a successful surgery, especially given my own case, which is that I already had a liver disease, and I was told time and again that I could have complications. But I came out without any complications. I thank God first, but I also thank the doctors who took special care to ensure that I didn't have the kind of complications that were feared. My wife is with me here. She came and has always been with me to take care. I'm sure when I wasn't conscious, she must have observed a lot of things too.
Yeah.
Yes.
Yeah. My husband, Mr. Valentine, we came to India for the liver problem, like the doctor said, and then after several tests, we discovered it was discovered that they had to do something on the lungs. I can say that this is the first time I'm experiencing medical care in a very natural way. I had described the doctors as gods. Somebody was laughing at me, was laughing. I said the doctors are gods because I was really, really scared. You know, it's a difficult thing, the way I saw it. But the way they went about it, apart from their professional skills, professional expertise, the way they handled their patients, Dr. Poramesh, Dr. Sundar, they were really, really wonderful. And when someone asked me, I say, oh, they are gods. And then he told me he heard that anesthesia is usually a painful experience when you are recovering from it, but that this time it was so smooth, he didn't even know that something happened to him. You know, so we are really very grateful to the Apollo team and the doctors. I think Apollo Hospital is blessed to have the best staff, doctors, nurses, even the staff at the International Patients Department. They are really, really wonderful. They made our stay here comfortable, and I think we are going to come back. It may not be for health reasons, but we are now a family. We see them as a family, so I think we are happy.
Well,
We
thank
don't
you
know
for your
how
kind
best to
words.
express our appreciation.
Well,
but
just carrying a little further in what we said, exactly what you were saying. Taking out of a part of a lung is what we call routine surgery. But what was not routine in his case was he had a weak liver,
yeah.
which meant that his blood would not clot normally and it affects healing. So we had to take that much care, and we had a planned approach to make sure he had not even the slightest complications, as you were saying.
Yes,
Because
that was where I was really scared, but the way it was handled, I think I'm really, really impressed.
I think it just went like clockwork.
Yeah.
The operation went as planned, while you are keeping a watch, a close eye for any complication.
Yeah.
Well, we managed to prevent them, and that he is ready to fly home tomorrow.
That's wonderful. I think it's a miracle.
And also the liver disease what he had is infectious to other people, the staff members involved also. So we took precautions on that, and then able to bring him out without affecting the staff members. That is also there, and we are quite happy with that we have got a very good patient, so that we can give a very good result.